Enloe Medical Centers sought out the STEMI designation because they realized it was a benefit to the community, to the hospital, and to the patients involved that were having heart attacks. Prior to our STEMI Receiving Center designation, a patient would call 911, an ambulance would be dispatched to them. The medics would treat them in the field with the protocols that they have. They'd be taken to the closest facility capable of taking care of somebody with chest pain. Once there, they'd be seen by the emergency room physician. If that physician felt that a cardiologist would be needed, they'd call in a cardiologist. The patient would stay there. They'd do lab tests, they'd do x-rays, they'd do an EKG. If the patient was really sick, they'd be admitted to an ICU or a CCU, and then they'd be treated. And if they needed to be treated by something that wasn't available at that hospital, then they would be transferred out to the closest facility that offered that. The physicians at Enloe felt that this was too time-consuming and didn't help the patient. Since Enloe had a heart program and we have invasive cardiologists, and we've been doing invasive cardiology for some time, some of the physicians felt that what we needed was to bring the patients directly to the medical center and eliminate that middle step. So we sought out this designation so we could have a system in place that would bring patients directly from the field to the cath lab and have the cath lab there in place ready to take care of this patient as soon as they arrived. There was several studies that showed that the sooner the clot that was causing the heart attack could be alleviated, the better the survival rate, the decrease in morbidity, the decrease in disability that patients had. They spend a very short time in the hospital now, and they can go back to almost, a lot of times back to where they were before they even had their heart attack.